Okay, students, so we're going to start here with responsibilities of an X-ray supervisor. This chapter is short. There's only a few objectives that you'll need to be able to answer. So we're going to talk about what is a supervisor, what is a technologist, and what are their responsibilities. So the X-ray operator and supervisor permits. So any person posing an X-ray operator and supervisor permit is subject to a wide variety of state and federal laws and appropriate regulations. And there's also county statutes or ordinances that could come into play in addition. So if San Diego decided they wanted to be a step up from the state, they could do that. The only person who possesses proper and valid up-to-date certificates or permits issued by the states are authorized to expose human beings to X-ray for diagnosis. All right, so those people that can do this, it's people of the healing arts, so an MD, which is a medical doctor, DO, doctor of osteopathic medicine, and I'm not sure what a DPM is, but there's also the doctor of chiropractic. I think that's private medicine, doctor of private medicine. So those people who possess of the following authorizations may expose human beings to X radiation within the limits of their professional licenses. So with the radiology supervisor and operator certificates, it says that they are American Board of Radiology or American Osteopathic Board of Radiology certified physicians who practice is limited to radiology, including image intensification. So that's interesting. So they can actually do image intensification. So with the fluoroscopy supervisor and operator permit, are licensed who energize fluoroscopic image intensification equipment themselves or directly control radiation exposure to the patient during the procedure or supervise radiologic technologists who hold a valid fluoroscopy permit. So that's the difference there. Then there's the radiography supervisor and operator permit, and that is licenses who activate or energize radiographic equipment themselves or supervise radiologic technologists or limited permit technicians who perform radiographic exams. And then there's the dermatology supervisor and operator permit, which is licenses who use low-level X-ray treatment for skin disease. So they are able to use radiation to treat patients. So there's 4 distinct groups of individuals who can expose in the state of California. So there's us, the certified diagnostic radiologic technologists. There's the limited X-ray technicians are prohibited from performing fluoroscopic image intensification procedures. So they are not able to use fluoro. They can only do certain X-rays. So there's also this students under a state approved supervision of a CRT may perform radiographic procedures. So when you are a student in our program, you are allowed to go with someone into the OR who has their license and work with them, but you're never allowed to work alone. So students are prohibited from performing fluoroscopic image intensification procedures by yourself. So specific supervisor responsibilities. So they establish a fluoroscopic fluoroscopy procedure manual and they review it annually and update it. They assure that the technologists do not practice medicine. That is, they perform fluoroscopic procedures without specific standing orders or direct orders. So you have to have an order every time you do a procedure. So, and it's actually written on our state license so that we have to have an order signed by a physician. Observance of technologist performance at regular intervals, but not less than monthly, to assure that the technologists carry out their fluoroscopic duties as required. So the person that's in charge, the supervisor, is supposed to come in and look at you guys every month and make sure you're doing what you're supposed to be doing. And assurance that the technologists are offered in-service training to maintain their competency. An assurance that all fluoroscopic and ancillary equipment monitoring are adhered to as described in the quality assurance and quality control programs. So with personal protection, supervisors shall ascertain all of the following. So the supervisors actually have to state this. The operator is adequately protected from scatter radiation, and all individuals who must remain in the room during the exposure should wear a protective apron of 0.05 millimeters of lead equivalent, but the minimum is 0.25 millimeters of lead equivalent, but the state really wants us to wear the 0.05. So, along with that, there's also the film badge, or the TLD. It has to be worn at the collar level and outside the collar. So outside was their big thing. You are also supposed to wear your protective apron, your thyroid shield. There's the overhang shield. If that's available, use it. A mobile screen, you need to bring it in place if you can. A hinge or sliding panel to protect yourself. And you should wear gloves and leaded glasses if possible. So with the medical legal, most of it goes under administrative law when it comes to radiation supervisor. So that's about all I think you need to know on that. You don't have to know much more than that. But the state and California regulations for diagnostic x-ray equipment and or operator certification fall into the following broad categories. So we're going to kind of cover these categories. But they are persons authorized to operate x-ray equipment on human beings in California and the restrictions which apply to them, the display of documents that have to be up, the record keeping requirements required by the state, training and or information an x-ray supervisor is required to provide to the fluoroscopy equipment operators, fluoroscopy equipment safety provisions, x-ray room shielding provisions, registration and vendor obligations, and supervision of x-ray operators who use fluoro equipment, and formal training of x-ray personnel who use or assist the use of the fluoro equipment, which is actually under review currently. So restrictions of the CRT. They may use fluoro equipment under the supervision of a certified supervisor and operator. So when you guys go into the OR, it's really important that you make sure that the person who's telling you and guiding you in the procedure in which you're doing is actually licensed. You can only work under someone who is licensed. So if they are not licensed or their license has expired or they're suspended or whatever, you can't work. You can't bring that C-arm into that room. It's a fine for the physician, it's a fine for the hospital, and it's a fine for you. You are held liable because you went into the room. So you do need to make sure that they are licensed. You may not interpret any radiograph or make a diagnosis based on the images that you're seeing unless the doctor directly tells you to. And usually you need to get that in writing. They may not use any title or designation implying or indicating the right to practice. So you can't refer to yourself as a doctor in any way, shape, or form. So the display of documents. The X-ray supervisor and operator permit, certified technologist certification must be predominantly displayed in a place of employment. So a single list with names, certification numbers, and expiration dates are fine, especially in the larger facilities. If working in more than one facility, you do need to make a copy of your license and have it posted so that when the state comes in or for anyone, they can refer to it. A current copy of California radiation control regulations and a copy, that is your Title 17, and a copy of operating procedures applicable to working with x-ray machines and procedures must be posted or must be readily available to each x-ray operator under the supervisor's jurisdiction. So a current copy of the notice to employees must be posted. So Jill and I have gone into all the facilities and have checked to make sure that all of the stuff is posted. So each user is required to maintain a current and complete record. So the results of each required calibration, survey, or test, each receipt, transfer, and disposal source of radiation exposure of all individuals for whom personnel monitoring is required. The exposure records must be kept in a manner in which includes all applicable information regarding occupational exposure. So we actually keep those indefinitely. Personnel monitoring entry must not exceed a year, so it should be done monthly like we do. We actually have your badges read every month, and we record, needs to be in rems, millirems, and dose equivalent rates, or millirems per hour. So each required record of dose equivalent received by the individuals of a medical examination must be kept indefinitely. We keep them forever. All others require 3 years following the date of occurrence. The user is required to provide a report of any individual his or her radiation exposure data. So we always, if you contact us, we'll always provide you with your radiation dose. So incident notification requirements. So the State Department of Health must be notified when individuals are exposed to radiation other than prescribed for medical purposes in excess and limits that we're going to talk about in just a minute. So immediate notification by phone, and a letter must be sent to the state within 24 hours of the incident. And overexposure of film badges need to be investigated to determine the condition under which the overexposure occurred, conditions in which it occurred, and reported to the RHB within 30 days. I've actually done some research as the safety officer for the campus on why some of the badges came back high, and was able to get those badges back down. They're never at a level that would alert the state, but I didn't like the idea that there are some high badges at one site, so we're able to lower those badges down. So immediate notification is required if an individual has received a total effective dose of 25 rem or more, an eye dose equivalent to 75 rem or more, and a shallow dose equivalent to the skin or extremities of 250 rads or more. So 24-hour notification is required if an individual has received within 24 hours a total effective dose exceeding 5 rem, an eye dose equivalent exceeding 15 rem, or a shallow dose equivalent to the skin extremities exceeding 50. So the technologists, you have to have formal training and or information. A registered user is required to provide to radiologic technology personnel. So you actually, I will be giving you an attestation stating that you have completed your flow of training, and you'll need to provide that to the state and to the places that you trained. So it's governed by school standards set by the state. No informal training is permitted, although they do recommend that you continue continuing ed, and they're actually changing the policy on that, where you have to get continuing ed in fluoroscopy. So the responsibilities regarding x-ray equipment, so machine registration requirements and vendor obligations. So the equipment must be registered within 30 days of acquiring to the RHB. And you have to pay a registration fee and, of course, an annual fee for the equipment. So sale, transfer, disposal of any x-ray equipment or x-ray machines must be reported to the state. And did you know it's your responsibility to inform the person who acquires your x-ray machine that it must be registered to the state? If you don't, you're held liable, which is interesting. So responsibilities also, so renewal of individual certificates and or permits. It must be made 30 days prior to the expiration of each certificate or permit. Don't let them expire. So it must be on a form furnished by the Department of Renewal notices before the expiration of the certificate or the permit. So 30 days prior to it expiring. And x-ray equipment safety provisions. So no user shall operate or permit the operation of x-ray equipment unless the equipment and installation meet the acceptable requirements of California radiation control regulations and are appropriate for the procedures to be performed. So important stuff there. Safety inspections, this is a good one. And some of you know about this. The State Department of Health services are permitted without warrant at all reasonable times to inspect x-ray machines, activities, facilities, premises, and recording pertaining to radiography and or fluoroscopy and associated supervisory activities. So the last thing here is x-ray room shielding provisions. The state has left that up to a physicist because there's so many different kinds and brands and everything else, so they just left that up to the physicist, which is nice. So enforcement, so the health and safety code, it shall be unlawful for any person to direct, order, assist, or abate a violation of certification provisions. Any person who violates or aids and abets the violation of any of the provisions of the law or regulations is guilty of a misdemeanor. Don't get involved in it. So California Code Regulations Title 17, every department has one. The user shall assure that x-ray equipment under his or her jurisdiction is operated by the persons adequately instructed in a safe operating procedures are competent and safe. The user shall provide safety rules to each individual operating X-ray equipment under the control, including restrictions, operating of techniques required for the safe operation of particular X-ray apparatus, and no user shall operate or